When it comes to solid organ transplants, the role of the pharmacist has undergone a dramatic evolution in the past 2 decades. Right now, discover how these specialty pharmacists meet critical needs to serve patients before and during surgery and provide care for life after a transplant.
The only reason that transplantation is successful is that we have medications that suppress the immune system and prevent the body from rejecting the heart or the kidney or the liver. I tell patients that transplant is certainly a miracle of modern medicine, but it's not a cure. You're basically trading one illness for another illness. You're trading the illness of advanced heart failure for the illness of chronic immunosuppression and post-transplant care. So transplant pharmacy is critical to the management of a post-transplant patient.
If you're still having issues,
our job is really to maximize patients' use of medications.
There's a medicine we can use to try and help with the tremors.
The only time it's really bothersome is when I'm trying to do something, or when my head starts to have tremors.
There's some science behind it for sure, but as you get more into this, you realize that transplant is really a big thing about the art of medicine. Some of them are on a lot of medications coming in, managing other comorbidities they might have, but now you're gonna have all of these other medicines to keep your transplanted heart going.
I've been maintaining 203, 200, 201.
Those look really good.
Yeah.
Watching out for drug interactions, watching out for side effects. There's a bunch of studies that have looked at this on how many different medications, how many pills patients take when they leave the hospital. I mean, you're probably talking anywhere, maybe 10 different medicines, a combination of maybe up to 30 different pills per day. So it's a lot to manage.
So she did okay with that yesterday?
She actually did not get it.
Okay. The other thing that's changed in transplantation that we've been particularly at the forefront of is newer medications that are coming out to decrease antibody levels. These are new medications that act in different parts of the immune system, enabling patients to get to transplant.
So antibodies in your blood fight off things like bacteria and virus and fungal elements to make sure you don't get infected from them. Some patients have antibodies to other human antigens, and the antigens are the things on the organ that make it recognized as being different. So the antibodies attack them. We're a center that those patients get sent to, right? The other centers that would say, we can't do this, but UPMC can, so you should go see them.
And then you have the stop date for the acyclovir.
We have experience with medicines that will lower those antibodies and applying those to the right types of patients. And we've had really great outcomes. And that's been really through some of the research that we've done here.
When we list a patient for transplant, it's because we are 100% certain that despite all of the complications that can happen after transplant, they're going to have a better survival and quality of life than they would without a transplant. It's a relationship for life. So having a pharmacist on the team that's really up to date with all of these new things that are coming out is critical.
Here at UPMC, we have people that have worked all over the country that have come now here together to form this team. And we're all pulling on the rope the same way. We're all trying to do the best thing for patients. We're there for you the rest of the way.
So I take 2 at 1 and 1 at 5.
Okay. I'd be okay even if you wanted to take that magnesium down to just 2 tablets once a day.
That means no more 5 p.m. meds.
I'm here to make your life easier.
Yeah.
When you see a transplant patient, they're doing really well. They're telling you about their grandkids or telling you about a trip that they just were able to take. To be honest, in the back of your head, you're knowing that without the transplant, those things don't happen. Just knowing that I've had a little small part in helping them get there is huge for me. It's just uplifting like every day to come in.
Get news and free CME at upmcphysicianresources.com.